morning, my name is Kate. I'm a student nurse with Cedar Crest College, and today I am going to be discussing nurses' knowledge regarding pain management and assessment. So the main problem is that pain may be undertreated as a result of nurses not having the knowledge or nurses using opioids and analgesics inappropriately to treat pain. Nurses need current knowledge and appropriate attitudes to treat pain and do pain management techniques appropriately. So the research article that I used was Nurses' Knowledge and Attitudes Regarding Pain Assessment and Intervention by Deborah L. Shayer, Pamela D. Hill, and Mary Ann Anderson. The main problem is that individuals seek health care for many reasons, one of the main ones being pain. Nurses have a vital role in assessing and treating pain in order to keep the client comfortable. The main purpose of this article is to assess knowledge and attitudes regarding pain management from nurses. The research question is, what is the nurse's knowledge regarding pain management and assessment? What level are they knowledgeable at? And were the nurses adequately trained during not only formal education, whether it was a bachelor's degree program, diploma program, or associate's degree program? Were they trained adequately in school how to treat and manage pain, the appropriate medications, the appropriate interventions, and so forth? And also, when they were hired as a new employee, were they taught their hospital's protocols, how they manage pain management, and so forth? The study design was a non-experimental descriptive design used to identify problems in current practice. So pain management is a huge problem in the healthcare field. So this study is going to focus on things that they can do to improve that. The sampling was done by convenience sampling. Nurses were chosen at random. They could participate or they could choose not to. There was 129 registered nurses. They were chosen from 10 separate nursing units from 2 hospitals in the Midwestern metropolitan area. The inclusion criteria included you had to be a registered nurse to participate. It did not matter what degree level, bachelor's, associate's, or diploma. You just had to be a registered nurse to be included in the study. An exclusion criteria was if you were not a registered nurse, you could not participate. So physicians, secretaries, nursing assistants, radiologists, and so forth could not participate in this study. Only registered nurses, who are really the main ones who are treating and assessing pain. They're by the bedside, so if their patient wakes up in the morning complaining of pain, the nurses need to be knowledgeable on how to treat and adequately manage the pain. The data was collected via 2 questionnaires, pharmacologic, non-pharmacologic, and assessment questions. This is how they rated the knowledge level of the nurses participating in the study. The limitations varied. One of them was that convenience sampling was done, so nurses could choose to participate or not. So this did not allow for generalization of the results. Also, the data was collected during the winter months. So if there was bad weather, a lot of snow, which we had this past winter, data could have varied because people that wanted to participate may not have come to the hospital because of the weather. Also, the study information was administered during staff meetings. At this specific hospital, staff meetings are not mandatory, so not all staff attended, which could have varied how many nurses actually wanted to participate in the study because of the staff meetings not being mandatory. Not everybody may have been there. And also, they could not use outside sources for this study. The results showed an average score of 25.9 out of 32 possible points. It showed in this study, compared to other studies, that these nurses were actually very knowledgeable regarding pain management and assessment. A minimum score of 21 and a high of 31. So 31 is almost perfect. It showed no statistical differences based on shifts, age, or number of years worked on the nursing unit. So in conclusion, nurses in this study were above average. The main problem is lack of knowledge regarding pharmacological interventions and pain management. So nurses either are not using the correct medications or are using them inappropriately. The main thing that came of this study is that education is key. It is priority. Whether it is informal education, schools need to be on that pain management and pain assessment for patients is key. Regardless of attitudes, pain is a subjective, data. What the patient tells you their pain is, that's what it is, and nurses need to be aware of that. So that needs to be priority. It also stated that clinical competencies for employees should be priority in the hospital as well, making sure your staff and your nurses are up to date with pain management techniques and interventions. So what came of this study is that education is key. Staff, nurses need to be aware that pain is what they say it is. They need to know how to manage it and the interventions to use appropriately for their patients. And these are the references I used. Thank you.